All right, everyone, we're going to bring this Health and Human Services Committee meeting to order for June 20th, 2023. It is 4:00 p.m. on the button. We're going to start with Director Kevin McDonald from the Office of the Agent. How are you, sir?
How did you get to go first again?
Last time I made him go last.
Last. First resolution, I come with a heavy heart. I don't want to do this, but I begged her to stay, but she is insisting on retiring. So is seek authorization to fill the position of assistant administrator. I think anybody that's worked with Michelle Graham knows how valuable she's been to our office, and it's going to be tough to replace, but we have to move on. So move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Is Michelle coming on as a consultant?
Somewhere down the line, I'm hoping to get permission to do that, but we're trying to, our office is going through some changes now. We're trying to figure out who's going to do what, and once we get that settled, I may be back. Second request is to fill a budgeted site worker position out in our kitchen, again due to retirement.
I'll move it. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And my last one is a general resolution to contract with a place it's called Care Manage for All to provide a powerful tools for caregiver program for caregivers.
Do I have a motion?
I'll move it.
Second. Further discussion? All in favor?
Aye.
Opposed? Carried.
That's all I have for as far as resolutions. And just a quick report. It's not on my committee agenda because I just got the information today. Our the Everhome program that I'm sure everybody's familiar with, they're up to 35 active cases. That was as of last week. They're going to be going out to all the places where we distribute farmers market coupons, probably about 20 places that we go to, all the senior programs, all the senior centers, all the senior housing programs. And this month, she's doing presentations at our 5 nutrition sites.
Very nice. Any further questions for Director McDonald?
You going to that big barbecue they're having up there?
What now?
Did you get the invitation for the big barbecue that the Everhome Care or Ever?
Oh, yes. Thank you. I thought you were talking about, no, I thought you were talking about, we just announced it's just going to be in our newsletter. It's going out next week. And I think I was here last month to get a resolution approved to rent the Stuyvesant Falls VFW for. I thought that's what you were talking about, our big barbecue.
No, they're having a big barbecue up there.
But make sure to extend to Michelle Cram our sincerest gratitude.
Yeah.
Thank you.
What's your last day? You know?
July 8th or 9th.
All right, next, returning to us, Director Victoria McCann.
Hello.
Public Health.
Hello, everyone. Thank you.
Just sit right up to the table now.
That's right. Easier.
But you were supposed to bring the baby.
That's right. I heard that already.
Maybe next time. So the first item here is a resolution for authorization to fill one public health nurse position due to resignation. That is for our immunization coordinator
I'll
position.
move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Just a resolution for authorization to transfer PHEP, stands for Public Health Emergency Preparedness, grant funds from personnel to non-personnel expenses.
I'll move it. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And a resolution requesting authorization to contract with speech language pathologists for early intervention services.
I move it.
God bless you. God bless you. Did it get seconded?
Second. I'll second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And then the next item on the agenda was our annual report, which was submitted for 2022. I believe that's available to you
On their.
Yeah, yeah.
on our website.
Resource website.
And then moving into the May 2023 Director's Report. There were a total of 39 environmental health inspections, 10 food service, 14 ATUPA compliance checks, 7 water inspections. We had 16 new septic applications in May, and then 3 rabies submissions, 1 bat, 1 cow, 1 goat, all negative.
Anything else you want to highlight?
Yes. We had 55 COVID positive cases that were reported through the state eClair system in May. We had 1 death today, unfortunately, individual who was, had lots of other medical conditions going on. They were vaccinated. They had 1 booster. I believe they did not have a bivalent booster. But again, they had a lot of things going on. Yeah. Cases are low. In May, the federal and the global emergencies were lifted. So that changes how our surveillance will be going forward. The things that we're focusing on are hospitalizations, and we're taking a look at the wastewater for Columbia County. Right now, we only have 1 location where we're collecting those samples. There are incentives from the state to expand that. So we're looking into how we can support that effort. We do have public health emergency preparedness specialist now with us, who is taking a look at all of our plans, including pandemic response and all of the necessary plans that we have to have through the state as those are coming. So he's taking a look at those again. So they're reviewing, updating all the necessary items there.
So both of the COVID clusters this month were nursing homes.
Yes, they were very small clusters. There was no hospitalizations from those 2 small clusters.
The nursing home deaths still exceed the other deaths.
Correct. And a lot of our COVID funding is coming to, the conclusions. One item that I did want to mention is we do have lots of test kits, quick view test kits. If anyone is interested in having those in your town halls, you can let me know and we can get you those. People are still popping by for those, but nice to have them, sure. So you can just get in touch with me.
Can we get supplies for this building?
Certainly,
Are they
we've
still
got
paying
lots to work
for-
with.
Because we will have people come in and they put them out on the counter.
Yep. I'll make note of
What
that.
about the test kits that we received? I had a million of them, but they had extended the dates. Are they bad at this point?
It depends. You can let me know what the information on that, and we can look into that for you.
Another question for you. 224, I don't know if that was correct. Line cases,
Mhm.
is that higher than last year? Is similar at this point in time? I just find that it's the ticks are
The
awful
ticks
this year.
are outrageous, this
So is
year.
that, do you know if that number is?
That's about normal for this
Okay.
time of year. They did actually change through the pandemic. One of the things that happened was they changed the way we surveil Lyme as well. So there used to be the things would meet the case definition without necessarily getting the blood test. Now it needs to be a positive blood test in order for it to be Lyme. But we live in Columbia County. You get a rash, you call your doctor. Sometimes they don't even see you and they prescribe you Doxy for it or some other kind of antibiotic if they have that. So some of those, comparing year to year is a little bit tricky.
If they prescribe an antibiotic without seeing you, do they report that as Lyme? Or?
That would not come through e-clears. That would be, so that could have been things that we were missing in the past. But there's
Any
a lot of people going on
information
this
you
out
have that you can send to our towns? I think would be
Absolutely.
helpful that we
there.
can
So, and
put
we have
out because there was one time my dog was out, it doesn't come back with ticks on it. It's terrible.
I have 2 dogs and they must have walked through a nest or something because we brought them back in. They both have stress collars. We took off 20 between the 2 of them.
38.
Yeah.
My dog,
Okay.
dog,
All right.
38 off, I need you.
Yeah.
And that's one, I pull 3 to 5 out of me a week.
Yeah.
It's, I can't.
Yeah, it is awesome.
It's
So
crazy.
we actually-
He gets ticks all over.
We have a public health educator. If anyone has any kind of, community forum in which they would like to, bring her in. She's an expert on,
I made a
tick-borne
potion
prevention.
up that I'm not, seriously, and it works.
Mhm.
If anybody wants to try it, I've tried every natural one you can make. My wife and I came up with this thing and it works. So it's
Yeah,
all
I'll do it.
natural and it's pretty easy to use. And I spray it on it every time I take them out there. We went from 20 or 30 to most times none. Good.
So I can share, that information too, if anybody would like to bring, her in and she can deliver any kind of information to you.
So you can do that for senior, you can do that for senior lunch or something.
Oh, yeah.
It's been working. It's great.
Send it to me because my son.
It's simple to do and I bought a quart spray bottle.
And my dog's 120
really
pounds,
easy.
so I don't know
Okay.
size wise.
Well, we both will
Yeah.
combine.
Diesel
They're not
fuel and
so hot.
aftershave keeps the ticks.
I always work with chili oil and egg champa and have no issues.
Egg
I tell her.
Okay, we digress. Any further questions for Director
Oh,
McGann?
sorry, I just have a couple other things. So our migrant program, is busiest during the summer and fall, and so that's revving up again. And we actually just started today our new community health worker Spanish speaking. So we're really excited to get her on board and provide that service again. Early intervention and preschool services, all our vacancies have been filled, so our team is, up to where we'd like it to be. Unfortunately, we still, are facing challenges of transportation and provider shortages. But that's the situation over there.
And you said your referrals are booked out to September, October.
Yes.
What does that mean for kids that need services?
So they do their best to reach, anybody who they've got in the system already, and doing the initial assessments is a priority. So unfortunately, we just have to work on with what we've got as far as what we've got as the highest priority.
But this isn't specific to Columbia County, because I sat in on an
Correct.
ISAC
Oh, yeah.
conference,
No, I
and
know
it's
it's not,
everywhere.
but
It's
yeah.
a wide world.
Thinking about the summer and the school year.
Yeah.
It's a long time for a child to be without services.
And so, we also. Sorry, it's out of my head. It'll come back later. Okay, I had another thought. Oh, sorry. And I think that's all for me, unless anyone has any questions.
All right, any further questions for public health?
Welcome back.
Thank you so much.
Thank
and
you so
welcome.
much.
Thank you.
Thank you.
Oh, there's an emergency bill form. Did you sign that?
Yes, I did.
Can you give it to
Yeah.
Victoria to take back?
Yeah.
Thank you very much.
All right, next up, Director Almasi.
Everybody.
Nice to see all of you. So I have one simple request, resolution, excuse me. There it is.
Sorry, Dan.
That's all right.
Talking again.
No worries. So this is a resolution related to what we're calling New York State opioid settlement abatement funds. This is separate from the opioid settlement funds that came to the county directly. What the state has done is issued all of the LGUs, the local governmental units throughout New York State, a certain amount of funds to allocate as they see indicated. So after discussing, how we should proceed with receiving these funds and talking with the controller's office and such, it was suggested that we do a resolution that you see in front of you to accept these funds. And then there's a breakout there of how the LGU is interested in allocating this round of funds. These funds will come to us for, I believe it's the next 14 years. It's a total of 16 years. This amount of $283 some odd $1,000 was 2 years worth of funding. New York State Office of Addiction and Substance Abuse Services has produced an algorithm so that the LGUs can see what they're entitled to in the years going forward. I've tried to figure it out, and I'm not a master mathematician, but I've actually asked the folks at Oasis to help me. They could not figure it out. So I'm going to be pursuing that because I feel it's really important to be able to know what we're going to be receiving in advance of each year so we can make plans and so on and so forth. So I'm working on that. But what you have in front of you is 2 years worth of funding and, the proposed allocation.
I'll move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
So just, so you can't do a straight mathematical 14 years times 140.
No, what I have been assured is that the amounts will get incrementally lower as we go deeper into 14 years, which is why it's important for me to know how much it will decrease each year so that we can plan accordingly and, make decisions in advance. It's a bit frustrating, I won't lie.
But it's money we wouldn't have otherwise.
Correct. So in that sense, it's a good thing. There's a silver lining to it. What you have in front of you is the overtime report. We originally budgeted $12,000. We hardly touched it, $2,500, basically leaving us with a closing balance of $9,436.94. That's really it. I can share with you briefly that the community listening sessions that were organized, you may remember when we talked about the opioid settlement funds that came to Columbia County directly as a result of the 3 class action lawsuits. It was decided that I act as lead, I guess, and work with other providers to get a sense of how we should allocate those dollars. The group agreed that the best way to do that was to create these community listening sessions, which were a total of 4 listening sessions throughout Columbia County. Tried to be strategic in terms of the geography and how we, organize them. Those have all been offered, and we will be meeting this Thursday as a group to begin processing, the results of what we heard from the community members that came out. The attendance varied, I can tell you that, but it wasn't poor. It just varied in terms of numbers, and the quality of conversation, I can assure you, was outstanding in all of them. It was really amazing. And even if it was a dozen people that turned out, the quality of conversation and what the public was telling us in terms of what they felt the needs and gaps were in their locality was really remarkable. So I'm really excited to talk with the group of providers that we organized and kind of process what we were all told throughout these 4 community listening sessions, and then bring those ideas and recommendations back to this group for you all to consider in terms of how we begin allocating what was 2.2 million between now and 2038. But I think what do we have in the bank so far? About $500,000, 600,000, I think, is what we received so far. So it's really not a lot of money, but again, it's something more than we had previously.
I just read that CVS and Walmart settled,
Oh, okay.
so there might be some more funding.
And there's only one pharmaceutical company that's responsible for this tranche of.
Was it? Okay, I may be wrong.
I think it was several combined.
I've heard 3 class
Okay,
action
then I'm
lawsuits. So,
incorrect.
all right. It's tricky because I looked at that report as well when we learned that we would be receiving those funds, and there's monies that are unrestricted. There's monies that are restricted. Thankfully, the restricted monies, the restrictions are very generous, so it's not very prohibitive in that regard. So I think we'll be able to, find a place to use it quite easily. But the fact that it's being dragged out between now and 2038 is a little unfortunate.
Were you able to attend one or more of the listening sessions?
All but one of them, yes, absolutely.
Was there any general consensus across them, or were they unique to the geography of the?
General consensus, yes, and then they were unique to the localities. I can tell you some of the themes. Definitely, there was a lot of requests for more prevention amongst young people in the schools and such, which I forget where we left off, but I'm happy to report that we do have a substance abuse prevention provider here in Columbia County. We were without since December of 2022. So Twin Counties has responded to the RFP that we put out, and we are, I believe it went through full board, and now we're going through contractual pieces of it. I think I just signed the contract today, and it'll be headed to the chairman's desk. So I've met with Twin Counties already. Tara Van Roy is the director of the Greene County Prevention Program, and she's doing a wonderful job there on that side of the river. So I'm very excited to have her here and to bring her skills and talents. And in just talking with her and Keith Stack, they're going to be bringing a lot to that role. And maybe, and I don't want to get ahead of myself, so I say this with trepidation, but we only receive $140,000 from the state to provide substance abuse prevention services in Columbia County. That's not a lot of money. However, hearing through these community listening sessions that that's what the public is interested in, wants, and needs, it wouldn't be any sort of a leap to take some of this opioid settlement money and direct it towards something like that to subsidize the 140,000 so we could get more of a more robust prevention program. But we'll see how this shakes out and where the dust settles in terms of, what all of you think would be the best way to start spending that $2.2 billion that has come to us, and maybe more money as a result of the settlement with CVS and such. But that's where things stand. There's some optimistic information as far as the clinic goes. Our care coordination programs are fully staffed. Our non-clinical positions in terms of, support positions are fully staffed. It's just those clinical vacancies in the clinic. However, I'm about to, I have start dates for two social workers who will be joining us in the month of July. There's a former student that is working on her limited permit, it's called, which we can bring people on board now with limited permits. She'll be returning to us as an employee once she gets all that squared away. So that's 3 new hires. And then I'm receiving resumes. So we're in the process of setting up interviews.
That's very positive.
It is. It's very refreshing to see that. Not all resumes equate to a new employee, but you got to start with the resume, and that's happening. So I'm happy to report that to all of you.
Terrific.
Thanks.
Any further questions? I attended one of those listening sessions and it was well attended, and there's a lot of good things that can, so looking forward to hear.
Thank you.
All right, thank you, sir.
Thank you.
Up next, Department of Social Services, Commissioner Gibson.
Start out with, by and large, these are personnel resolutions brought to the Point One Committee this morning, all budgeted. First is a caseworker.
Second.
All in favor?
Aye.
Opposed? Carried.
The second is 2 social welfare examiner positions.
Second.
Further discussion? All in favor?
Aye.
The third is to convert 1 typist to a community services aide.
Move it.
Do I have a second? Second. Further discussion? All in favor?
Aye.
Opposed? Carried.
And number 4, I have an existing agreement with Greater Hudson Promise Neighborhood. They do an awful lot of our, they provide us with an awful lot of our prevention programs. They also provide oversight to prevention in the county generally. So even if they're not providing the program, they oversee prevention. And we want to open up and add 2 programs to that. I think everybody got the contract. The youth director who goes next can go into it with a little more history and length, but essentially we're looking to bring a local circus around to different parts of the county. That was originally to be used at the summer youth programs and the camps, but on further requests from some supervisors, it's also going to be opened up to families. So they'll be given a little bit later in the day. So that's 1, and 2 is a boxing program that lost its funding. We certainly have the funding to go with that, and Greater Hudson has the ability to host that program and bring kids over to Catskill to participate in that. So I think that's quite an excellent mission. And I would just ask that,
I'll move that.
I'll second.
Further
Excellent.
discussion? All in favor?
Aye.
Opposed? Carried.
So happy to see these things coming in line.
thank you very much. I will say I had a conversation with Supervisor Knott this morning, just based on he had some questions, and they were very legitimate about the circus. I think the
Did you
circus.
speak to the controller about it or somewhere else?
Yeah, and I totally understood. We think it's a good community. Yeah, it's not an ongoing thing by any stretch, but a way to bring the community together. So I appreciate that call.
No problem.
And I know the youth director is going to get into that.
That's right.
Hey, Bob, do
Yeah.
you want to talk about the burial policy?
Well, it was another, Annie had put that
She
on.
put it on the,
She did. So just a quick update. I did change it quite significantly, and so I'm just gonna have the lawyer get that together and put it in a final version. But I did that in consultation with the directors of the homes around, because for years there's just been a disconnect between services rendered and what the policy allowed for. And I didn't realize, for a lack of a better way to put this, they did the work and they did it very well, but they were taking it in the teeth. And I did not realize that. And we have money set aside to rectify that. So we took our time and put together a policy that made sense for everybody, including the client. And so that will be sent out to all of the supervisors through Kelly in the next few weeks, and you can go about it the next days.
So I have one question about the monthly report. The
Sure.
homeless numbers are still hovering around 100.
Yes.
I don't see any significant decline since the coal months. Is that because there are just that many more, or are we housing the same people? I mean,
It's
usually,
both.
okay,
Yeah, so as you supervisor, there are usually this time of year,
about half
certainly
that.
pre-COVID, we do about half. And there would be some more chronic that we deal with. Well, we continue to deal with that chronic, but we have waitlisted right now 24 folks who would be in apartments if only we could get them.
Okay.
They have money to do so. We're working on that issue. That's a very good question.
The recovery kitchen has all the supervisors, I think, were on the list today, sent out a survey about food insecurity in the county. And I just want to encourage people to respond to that, because it goes hand in hand with this. And I think they're providing a lot of food for homeless people in various locations too.
Well, another excellent point, and that did sort of come up at my table when I have all those folks come in from time to time to sort of update. We do a lot of work together, including the Salvation Army, whose board I sit on. That's where that sort of developed. I will say, and it's a little premature, so I have not brought it up, but it does remind me that I'm likely going to bring to this group in a month a proposal that use the church on Green Street as a mission this winter to put code blue clients in. Not only will it be a great savings and allow for more nutrition,
Right.
and it will be significant for nutrition. Frankly, we don't have the space to take on anybody. I've never been full in my entire time as
In the summer.
commissioner in June.
Right.
We are full. We are sending folks out early. That's just something.
So the thing we have to work on for the code blue is staffing, right?
Correct.
Okay,
And,
that's-
but it sounds like our partners would have that staff.
Oh, terrific. Okay. I'll
And
catch up.
so they're
outside
putting,
of this.
yeah, you
Okay.
certainly will, and I'll be.
Overnight staffing as well?
Overnight and the like, and also engaging Bill Hudson to sort of renovate their space. They have a lot of great space over at the church, and I don't know quite, and I apologize for saying, I'm not sure in the, Dutch Reformed Church, how to refer to their, oversight, in Albany. It's different than, yeah, it's different than a diocese.
Yeah.
But they're very much in favor of this and have offered to put some money into this. We have code blue money for building as well. So we
Is this
think,
the church in Clover? Is this the Reformed Church? in
no,
Clover?
this is on Green Street.
Where's Green Street?
Literally, you can
Okay,
walk.
so we're
to
talking
our
about the
building.
same church, right?
Yeah.
I just wasn't sure. if it was really-
It's just, it's a little bit early, so I kind of let the cat out of the bag, but I think you'll be very pleased next month.
I'm good.
Thank you all.
Thank you.
Change.
Director Grandin, May?
Just a couple of things. First, I want to really thank the commissioner because he's really supported a couple of these ideas that I've been bringing to him. And two are the boxing program and the circus program. In terms of our prevention money, there's a good amount of money there to work with Greater Hudson Promise, and I think these two are really good programs. The boxing program was housed after the Moose Club for a little while, if you remember.
I do.
But it's no longer there, and there's 40 kids, Columbia County kids, that are traveling over to the Custom Model Gym. It's a really good program. The hours 3 to 6 program, so we're really excited about supporting that. The circus program, again, they're going to do 6 Tuesdays in the summer from 6 different playgrounds, with a couple playgrounds matching up with each other. And they also offered us 4 3-hour community events. So I've reached out to I think your person, reach out to you. I think I'm going to reach out to Ms. App, that if you have something going on in your community and you're looking for like a 3-hour circus show, they're willing to do that. So I think if I just give a little bit, like a 2-3 week leeway to give them some notice, they said they'd be more. Okay. Let's see. The Think Differently program. So tomorrow we're going to meet between 1 and 2. And we have a proposal that's been delivered. We're going to discuss it tomorrow to see if we want to add, alter, delete, and hopefully next month we'll be able to bring a proposal to the board. Okay. And our resource allocation plan for 23 was approved and sent to you, right, Chairman?
Yep. Can you just quickly describe the Think Differently program, please?
So the Think Differently program was born out of Dutchess County. Marcus Smallmarrow's son was dealing with son, I guess.
He's diagnosed.
Yeah, diagnosed on the spectrum. I'm just not sure how to say that. So this is really about a program on how to handle, educate folks that work with kids on the spectrum, offer programs that can actually encourage kids on the spectrum to participate. I think our first rollout is going to be at the Chatham Fair, the start of September. But I think it's going to coincide really well. I was on the Youth Prevention Network phone call as well today, and they're dealing with a lot of issues with spectrum disorders as well. So I think it might be a really good fit that doesn't exist just yet. So we're excited about that.
So it's going to be to educate the public at large too on dealing with children on the
And we are a Think Differently county. We passed.
Let's say we passed something a couple
3 or
years
4
ago.
months ago, or 3 or 4 years ago.
2018.
8 years ago.
Early,
No,
early,
sorry.
early to the game.
And again, we have a dynamic director out there, Cornell Carp Extension, Lisa Galena. This is right up her alley, right up her ballpark. She is good. She understands this. She's done it. So I think we've really made a good alliance there to really bear this out. I think,
Is this something that would also go to the school districts potentially?
yes.
Okay.
Yeah, because the Cornell's already involved in the school districts. So, yes. And then the other thing is Thursday night is draft day, NBA draft. And my son is going down. His good buddy's about to be drafted. It's in the first round. He's Albany Academy. I don't know if you're familiar with Andre Jackson. He was on the UConn team. So he's going to be not a number one, but round one. And he's promised to come down and spend some time with some of these programs down here. So
Nice.
I'm looking forward to having him come down.
That is good. Grown-ups might want to come.
Yes. Well, he's about to be a
I'll find somebody to
multi-millionaire
bring.
Yeah.
Thursday, right?
Well, I'll say
Send a
this.
kid.
Anybody need transportation?
He threw out the first pitch
Yes,
in the field on Mets game earlier.
he was there.
Might have been the last time the Mets won.
Anybody want to grab the picture one?
I can't say anything, because I don't want to.
Yeah.
I think that would be good.
Excellent.
Cool.
Thanks.
Thank you.
Thank you, sir. Director Almasi, you had sent me an email a while ago about discussing another item in front of this committee, and I'm sorry for bringing it in front of you right now.
Yeah, that's okay. I was gonna ask you if we could maybe set up a time for a phone call and just bounce it off of you and you could give me guidance in terms of, you know, what might be the right time to bring it here. I don't want to speak critically in front of everybody. I had a brief meeting with Twin Counties and Carl Quinn, the director of Greener Pathways. That's an offshoot Twin Counties proper. They have the certified recovery peer advocates, the people with lived experience component of Twin Counties. Unfortunately, they informed me that OASIS, the Office of Addiction Services, is cutting their budget on a program that is intended to do mobile outreach to people with opioid issues. And, you know, this is going to leave them with a significant deficit. So the question is, how do we approach this? And I guess I'm getting ahead of myself as usual, but I wanted to talk to Chairman Collins and say, hey, you know, do we solve this with opioid settlement money? Do we solve this with the county kicking in the way that, you know, there was some, I think it was ARPA money that funded MCAT or the mobile field response team. I forget which bucket of money was used for what, but the county took a vested interest in both MCAT and MPT field support team. And now we have another provider that would like to maintain the level of service that they're offering to this very needy population that has acute needs. And Carl Quinn and team of Surface have been doing a fabulous job of this. They have a mobile response van and everything. They've been going out.
It seems counterintuitive. Why didn't they continue with that?
You know, I haven't yet reached out to Oasis to ask that question. I'm not feeling optimistic that I'll get a satisfactory answer. Supervisor Adams, but I felt the same way. It's upsetting actually, because you know, there's all this money being poured into behavioral health right now as a result of the new budget, which in fact is really not as much money as one would think, you know.
Always a way to make it sound better than it is.
Yes, but so there's at least a spotlight being shown on behavioral health, maybe let's put it that way, in the way that it hasn't been shown in years past. So for one of the state agency that oversees the substance use disorder recovery to cut it is pretty egregious in my opinion.
I will say that ARP is time limited. It has to be earmarked by 2024,
Right.
and it has to be spent no later than 2026. So
So the
that's
clock is ticking.
on that, yeah.
And we re-obligated 175 for the MCAT.
I'm sorry.
I think, didn't we obligate 175 for the MCAT?
Yes,
And
and
that's
I
what
should
the MCAT
mention,
number is, which is
right,
three.
and that was our portion as Columbia County agreed to
Right.
put up the same amount. In regards to the field support team, which is a pilot, that was I think $180,000 added, call it 200,000, and we put it 400,000 as a 2-year pilot.
Mhm.
So, you know, there it is in a nutshell. And I just wanted to talk to Chairman Collins about the nuances of how we can go about this. And, you know, but, Twin Counties and Greener Pathways, you know, has their allotment minus the 10% to get them through. But this is what I didn't write down on my pad. I think what their ask was, and I don't want to be quoted on this, I think it was like 140,000, but that's to be split between both counties. You know, so if it's 140, our portion of that would be the 70,000. But I need to verify that. I want to make that perfectly clear. I had this conversation 2+ weeks ago before I went on vacation. So I just want to clarify that. But the bottom line is they're coming to me to see how I might be able to help them. Another option would be something that is available, which is known as federal salary share dollars. I believe the current balance on that is some $400,000. So this is the dilemma that we're faced with most recently in regard to this provider.
Well, thank you, and my apologies for
It's okay.
bringing that up out of order. All right, I think that's it. Do we have any questions from the supervisors or any of the directors? Do we have any questions or comments from the public? That being said, I'm gonna ask for a motion to adjourn.
make that motion.
Do I have a second? All in favor?
Aye.
Opposed? Carried.
Okay, I'd like to call the June Public Safety Committee meeting to order. First department up is 911.
Good evening.
Good evening, how are you?
Good. There's a personnel resolution request to lateral transfer emergency dispatcher. Request to waive steps and the waiting period for health insurance. The position was requested to fill earlier, but we don't have a civil service list right now. So we put out the position to the laterals. The position that it replaces is a person that retired last year. And the overall savings between the two budgets will be $12,216.88 annually.
I'll move it.
I'll second.
All in favor?
Aye.
Opposed? So carried.
Second personal resolution request I have is to fill up to a pool of DM emergency dispatcher positions at a rate of $19 to $23 per hour. It is vacant. It doesn't require a budget amendment. We've always actually had the position. We've just never been able to fill it. When we put out a request for lateral transfers, we ended up getting somebody interested from Dutchess County that's a full-time person there is willing to work with us part-time, which will help us out greatly. Requesting that to be an emergency fit if possible.
Move it. Second. All in favor?
Aye.
Opposed? So carried.
A resolution request authorization to accept the 2022-23 hazardous materials emergency preparedness grant totaling $16,000.
Second. All in favor?
Aye.
Opposed? So carried.
Have a resolution request authorization to accept the 23 State Homeland Security Program grant totaling $76,821.
Move it. Second. Second. All in favor?
Aye.
Opposed? So carried.
The only thing left, agency data from May of 2023 received 4,322 incoming calls. We dispatched 1,338 EMS agencies. Made notifications and dispatched 461 fire agencies, 2,114 police polls, and 545 public service calls.
Any questions? Thank you.
Thank you.
Thanks, sir. Public defender? How are you, Shane?
Well, good afternoon, everyone. I have one general resolution request to accept a grant award for the fourth council at first appearance. This contract would be in the annual amount of $223,700.
Second. All in favor?
Aye.
Opposed? So carried.
Thank you. And as far as the reports, I have 131 new cases this past month. Arraignments by the CAFA attorneys, 76. And I'm sorry, that's the daytime by me and my staff. The CAFA is 19. And that's all I have.
Any questions for Shane? Thank you.
Thank you. Thank you.
Fire coordinator?
Good afternoon.
All I got to report is the agency data for April and May. As you can see, year-to-date totals, we are picking up a little bit in emergency responses. We seem to have a little busier the last first quarter or so, a lot more mutual aid calls. So we've been running a lot more stuff, and hazmat's up a little bit over normal averages. We usually average probably 8 a year, we're already at 6. So that seems to be going up. Positive news is training facilities being well used. We ramped up a couple thousand hours in training hours, so that's all good stuff. So that's getting used and it's very much appreciated.
Great.
The only other thing I got, since we put the agenda items in, I got a bit of a tragic news. We lost a firefighter in Acton last Thursday. 37 years old, and it's the son of former fire coordinator Bill Hunt. And that service is going to be Friday and Saturday. So the southern end of the county is pretty distraught right now. Just thought you'd want to make sure you guys knew that. So,
Thank you.
all right.
Any questions?
I just had a question. Could we get an update on where we're at with the phone reimbursement? We passed a resolution to purchase phone.
Yep.
You were gonna reach out to everyone, find out.
I reached out
That already purchased.
2 months ago, and I've heard back from 2 fire departments, and 1 gave me a receipt. The other one hasn't given me a receipt yet.
Okay, did the LVPA get you what you needed?
Nope.
Did they respond at all?
Nope.
Okay, I will get on them.
Well,
They're the ones that requested it, so I brought it here.
okay.
Okay.
No problem.
Thank
All
you.
right. Thank you, Richard.
Sheriff?
Evening, everyone.
Evening.
We just had one resolution tonight, and that is to authorize the sheriff's office to enter into a renewal agreement with the Conic Hills, Ichabod Crane, Germantown, Chatham, and the Redmond school districts. We have 1 deputy sheriff assigned to each, the school district compensates us in the amount of $40,000.
Move it. Second.
All in favor? Opposed? So carried.
Then just a report on the incarcerated individual report. Dutchess County, 8460, Greene County, $9,375. Ulster County, $2,635, U.S. Marshal Service, $2,790, for a total of $23,000. For May, $23,260. Year to date, $211,185. Change from the previous 30, year to date from previous 31,815.
And what's the numbers, who's in the there?
43 total incarcerated individuals, 12 from Greene County, 2 from Ulster, totaling 14 boarded out. It's, and then last month's, we're 300% up from June of last year, and April's total was 2,900% up from previous April.
So right now, how many Columbia County inmates are there?
Total 29. Yeah.
Thank you.
So before you leave, Sheriff, just a quick question. I know there's busing issue, and then I know there's some questions probably for the sheriff, but let's just ask that question now, the busing.
The bus patrol?
Yeah.
Well, so for me, it was just more reporting. I was tasked at the last meeting at finding out from the schools.
Which they all were interested in.
All the schools would like us to do it, even the ones that contract with their buses, are on board. So I think getting.
I just was in Chatham today, and they actually said that the buses they get already have cameras on them, so I don't know how that's gonna work. And there was something, were you gonna, from Dutchess County?
If we were allowed to piggyback, you were gonna check with, I think, the county attorney, if we were allowed to piggyback on the RFP instead of having to go out, because it only makes sense to do bus patrol because
As long as,
Rensselaer County and Dutchess.
as long as our RFP says that we can pick it up.
Could you look into the, I know Rensselaer County uses them and Dutchess County uses them.
Their RFP bid that went out, because as Matt said, if it says that it's other counties are subject to use this bid, then we can. If it doesn't, then we got.
The individual from Dutchess said they did.
Yeah.
Okay, we should be in good shape. We just need to confirm it.
So I think the next step probably would be to bring bus patrol in here. That would be-
Right.
We tried.
We tried.
We tried for tonight, but they were unavailable.
So we'll try again for
So
next.
also speaking for myself, because I think this is important, and I know that New Lebanon wants to go to the base by September. If they can't make our next public safety meeting, maybe we can just hold a special meeting at a date that they're available. And I'm going to drive Johnson.
Right, we'll try to get them in for next month, but if not, we'll then try to make it special. All right?
I had a question too, Sheriff, since we just passed a resolution regarding the school deputy program. If I remember correctly, and I could not, when you came in, you had the focus of not having consistency so that relationships didn't form in a level where maybe the students or the teachers were kind of buddy-buddy with the school resource officer. I know in speaking to a few people in our school district, they feel like that relationship is what makes the program successful. So I'm just wondering if you still have that same mission of kind of switching people around, or if you've seen that through trying that, it wasn't as successful of a program, kind of where you're at with that.
Well, I think maybe it was partially misunderstood. Our long-term goal was not to have several different deputies in one school district. It was to have one deputy assigned to each school district, with having a deputy occasionally come in to one of the other school resource deputies come in and be able to be familiar with the school. If in fact the assigned deputy to say New Lebanon was either promoted or out on injury or some other event occurred, so that we had more than one individual familiar with the school. Long-term goal, we're looking to reestablish a deputy assigned specifically to that school for majority of the time. So we haven't established if it's going to be once every 2 weeks or the time period that the other deputy is going to sub in. But we still think it's important that we have more than one deputy familiar with the schools.
Got it. But your goal is to have a main deputy.
Absolutely.
And not have a lot of turnover.
We've been addressing some of the staffing issues. We're a good place right now. We're hopefully next school session we'll be able to accomplish that, but it all depends on our staff.
Okay, thank you.
Any other questions from the committee to the sheriff?
Yes, I have one question.
No, not yet, ma'am. Anybody from the committee?
Yeah, I have a question. I wasn't sure if you
Sure,
had it on the
yeah.
agenda you want me to ask.
You're a committee member, go ahead.
Yeah, so I know we talked about it at least implementation, but I was wondering if you could just sort of talk about the sheriff's position on the ICE policy and sort of if you could describe sort of what is the policy and how you're following it. I know that some of the people here are interested in that, and I think it's a key thing for people to understand what the policy is.
Well, we did talk in length at the police implementation committee. And we talked about one specific policy, which is 0101, which is a law enforcement policy. I know this is surrounding an incident that occurred a short time ago. And I'm kind of confused why it's still lingering. The law enforcement policy governs our law enforcement division. This was clearly something that occurred in the corrections division, and that policy has no bearing on the corrections division. So if you could, maybe restate your question and maybe just let me know exactly what you want me to attempt to answer.
Sure.
Yeah.
Well, that answers partly. I learned something. So the policy that that the states the sheriff's department would not collude with ICE, you feel like doesn't include deputies at the jail or activity at the jail. Is that what you're saying?
Well, colluding is kind of a broad term. I mean, in that particular event, there's no policies that were violated. Colluding with ICE could mean several different things. We follow our standard operating procedure as we do in any other event in regards to that particular incident. So I don't really see it as colluding. I see it working with other law enforcement agencies in a legal manner.
Sheriff, so far I was one of the police reform committee. I was doing that is that I should not want, sheriff should not contribute. I said any kind of, it was agreement and it was coming down by head page of the newspapers. It was that time was we believe that it will be followed, and I don't know what is their position right now. Sorry, could you explain that? Are you guys
that implement our policy, you are not a follow-up or you are how you want to do that. It is, I was a demanded and I was a personally demanded. Also that things. Also, let you know that person SPD was a couple of years, Michael knows, I was demanded into that I should not given it. I don't know what is the story position that policy. Are you follow up or not?
Yeah, the policy, the policy we're referring to is 0101. Again, it's a law enforcement division policy. Police reform does not govern corrections. Has nothing to do with corrections. You know, I think some of the surrounding information that is being translated in regards to the incident in question is misconstrued, which I'm not going to get into now because that's to do with safety and security of our office, and has also to do with particulars of that incident that revolve around that individual, which I'm not at liberty to give that information at this time. I'd be more than happy to sit down with any of the supervisors and discuss it further, but I don't think it's public information that needs to be talked about or put forward.
So I have a couple. So first of all, to clarify, I strongly disagree with that statement. We talked about it at police reform, and the request that was made by both you and Chair Redonia, who co-chairs that committee, is that conversation belonged in public safety. So now we're at public safety having that conversation. And so to again say, this conversation doesn't belong here, I strongly disagree. Your policies are public. I believe in open and transparent government. While you are an elected sheriff and we don't get to create the policy, we are the board that is allowed to ask questions. And so I strongly oppose the statement that we shouldn't be asking questions and having this discussion publicly. There's no executive
What the
session.
sheriff saying that he doesn't want to discuss particulars concerning a particular individual. I think that's, was that what you were saying?
I thought you were talking about this conversation. Okay.
In aspects of the policy
details.
and standing operating procedure that may affect the safety and security of our office and incarcerated individuals.
Right, specifics of a individual, I agree, but policy, I think, is exactly what we should discuss in public. So I have the 0101. Did I understand you to say that a policy of the Columbia County Sheriff's Office does not include the jail, or did I also misunderstand that?
So an administrative policy includes the entire office. We have a law enforcement division, corrections division, communications division. Obviously, you know, that set of divisions each have policies. This policy that was created in police reform governs the law enforcement division, which is the oversight of the police reform process. There are corrections laws that require us to do certain things, and police reform does not cover in any aspect corrections.
So even though this is a policy of Columbia County Sheriff's Office and doesn't say anywhere on it, only applies to this division, you're saying that it does not apply to corrections? Okay.
And if I could, corrections, procedures and policies dictated by state corrections, and
Some of them are dictated by state, other are standard operating procedures based on the needs and requirements of our office in order to conduct the activities.
So can I request a copy, not right now, but a copy of the immigration policy for corrections, whether it's a New York State policy or a sheriff's office policy, whatever policy it is that your corrections division follows, because there must be one. It's not just willy-nilly, this guy does this lady does that. Can I request a copy then? Because this is what I was going by, because it says sheriff's office, assuming that this was for corrections. So you're saying there's a separate, different policy that is for corrections.
Well, yes, corrections division has their own set of policies.
Could I request you send me a copy of the corrections policy that has to do with immigration enforcement?
Absolutely.
New York State or.
Could it please send me to?
Absolutely. I'll, how about I get it to the chair and he can disperse it. I can tell you that, it's very, there's very little in the corrections, only because certain laws that we have to follow as far as the commission.
Do you have any other questions, sister?
This one doesn't.
This is not. This.
So just to clarify, so we're all on the same page, policy 0101 is being followed, officers are being trained on it, and it only covers the law enforcement division, it does not cover corrections or activities at the jail.
That's perfect.
Did you have any other questions, sister?
Is what you sent her something I can discuss or no?
Yeah, it's a policy.
No,
Just
but
The addition.
F is not part.
F was put onto the,
It's a draft.
it's a draft. That's why I was clear to say that
F is not
that is not part of the policy.
Okay. Just
So it was forwarded to me, by the captain with F on it. And
So just to clarify, F completely contradicts what was just said because F only relates to incarcerated.
That's why F is-
individuals.
that's why it's not,
F is not.
but it's not on the policy.
I understand, but if the draft was, hey, we might add this to the policy, and now there's a completely contradictory statement that this policy doesn't relate to incarcerated individuals, you can understand the confusion there of like, what is true, what's not true. I feel like I'm getting
Well,
Two different
I can
stories.
clarify that. So
Okay.
our process and our computers, I'm not a computer guy, so I'll say our software, our DMS system allows us to, go through and review certain policies and other information that is on there. Obviously, the final decision is made by the command staff. This edition was not approved. This edition was not requested, and somehow it was sent out to the chairman without my knowledge that was even on there, because when I look at the policy, I look at the policy that's been approved. So we did a deep dive on it. That's been rectified.
Okay. So I guess my request, you create your own policy, take it or leave it, is that there's clarification on this policy because I was part of the police reform process that came out with this. And my understanding when I hear the Columbia County Sheriff's Office does not actively participate in immigration enforcement is that what happened the other day was not in compliance with this policy. And so I think clarification is needed both for the public to understand what that means. Because when I was on the committee coming up with it, obviously there are laws you need to follow. If ICE shows up at your door and says, I'm taking this individual, you can't say, no, you're not. But some of the things that occurred, in my mind, are actively participating. You could have released the individual. ICE will do what they're going to do with their own. And so I think there's clarification that's needed both for the public and for your office to understand what does that mean? Because my understanding, being part of the group that came up with the recommendations of this policy that your predecessor adopted, was very different from what occurred there. And I understand from you, you were following policy as you understand it. And so I think clarification is important so everyone's on the same.
Well, do you think that you are in violation of the policy as it's
Absolutely
written?
not.
Can you talk to us about that?
Number one, there's no oversight of that policy for the corrections division to follow. Two, even if they did, there have been no violation. We did not enforce any immigration law. This is standard operating procedure where we return an individual over to a wanting agency in the same manner regardless if it's a town, village, or state agency. We do it in a safe, secure manner that protects not only our employees, but the public and the incarcerated individual.
Mr. Chairman?
Just, I definitely can, but let's get through the committee and then I'll add. Is there any other questions from the committee?
I just wanted to state, I think, just to give some context for why this issue matters to a lot of people, is that, I think a lot of people knew him personally, or knew the family, or knew the employer. And so, when they serve their time in jail and they come out, I think a lot of people were excited for him to return to the community. Sort of, he did his time and to contribute. And when they get taken to ICE and they sort of are now far away, and I've heard rumors that maybe they'll be back. But it can be a devastating thing for the wife, for the friends and family. And so it's a meaningful thing that someone is taken into immigration enforcement, could be deported or could be separated from their family and their kids. And so it is a high stakes emotional issue. And I think I'm looking forward to having a good conversation about what happened, but I just wanted to give some context about the the reasons why this matters to me and why this matters to a lot of people in the community. And I think that there is a concern around people who don't have documents that can they trust local government? Can they trust law enforcement? And I want to live in a place where people can feel like if they are witness to a crime or victim of a crime, that they can like interact with local government to get the help that they need, and that everybody gets a fair shake. And people make mistakes, and people who are citizens make mistakes. I certainly know a lot of people who were citizens who made mistakes and went to jail and came back out, contributed to the community. So I think like that's the reason why these are high stakes. And so I appreciate sort of your willingness to have this conversation, but I just want to give that context for why this matters to me.
And I appreciate that. And by no means am I disputing anything you're saying. But as a sheriff, I have to, my main concern has to be the safety and well-being of the whole community, including the incarcerated individual, regardless of his status of being documented or undocumented, citizen or non-citizen. This is the same exact thing we would do in any other circumstance, regardless of immigration status. And no bearing on our standard operating procedure and no will in the future.
Any other questions from the committee?
Yeah, I'm looking at your website right now, and the policies that we're referring to are not listed on the website, are they?
No.
Yeah, I was not there, obviously, and I heard about it later, and the one thought that occurred to me was that it seemed from what I heard that people were there for a long time and then finally, I guess, came to understand that the inmate was no longer there. So I just wonder whether, this is rhetorical perhaps, whether some of this might have been alleviated if somebody from the sheriff's office had come out and actually just spoken to people and just said, well, this, and kind of own the situation, say, this is what happened, not the details of what happened, but just to diffuse the confusion and also there were supervisors there who, if they had been called inside and said, supervisors, come on inside and we'll talk to you. And if they had understood what was going on, and then they could have conveyed some of that, whatever was appropriate to the community, whether that might have diffused some of the distress that everybody was, as Michael has said, that people were feeling.
That's very well understood, and like I spoke with Supervisor Chimides about the context of what you're saying, and for example, the conversation we had in regards to your township and the costs that were referred. We had a conversation. You contacted me, and the situation resolved quickly and effectively. And there was no contact with any supervisor to me directly. I was not notified that there was supervisors outside awaiting the individual's timely release. I spoke with Supervisor Mossman, and she's very familiar with her policies because she's there quite often. Or released in a timely manner. So I think a lot of this could have been resolved by communication from both ends. And
so in other words, you folks didn't know that there were supervisors inside.
I was dealing with a family issue, so not able to be contacted due to some medical issues. So at the time, no, I did not.
Okay.
Any other questions from the? Okay, so I'll open it up to the public for questions, but please raise your hand and we'll just make sure there's everybody, excuse me?
State your name.
State your name for the record, please. Mr. Chaikin.
Mr. Chairman, for what it's worth, I just like this whole conversation in context as relates to this particular incident, this man was not a witness or a victim of crime. He was someone who was convicted of committing a crime, more than one felony in which children were victims. Whether or not there was a policy that was applicable to his situation or not, that's sheriff's policy to enforce or enact or not as he chooses. But just to put this in perspective, this was not a victim, this was not a witness. This was a man convicted of felonies in which a child, one or more children were victims.
We were discussing the particulars of this case.
No longer incarcerated, was released.
Ma'am, could you state your name, please?
Yes, so this is Marcia Martin. I work for the Mechanism Sanctuary Movement, and among the things we do, we accompany community members on their legal proceedings, especially when it comes to immigration matters, and I assist them in interpretation when it's needed. So I was there that day. And this person, yes, was being released after a jail sentence, after a conviction. But that sentence was done, and he was being released that day. We were there the whole morning waiting for this person to be released. And it wasn't until 11:30 that we were told by the undersheriff that this person not only was not there anymore, but that they were also transferred, thanks to the collaboration of the sheriff's office, to another agency. And this agency was Immigration and Customs Enforcement, known as HOUSE. So from our perspective, you're clearly violating this policy that you set in 2021. And we believe that it's also partially because, so we know, or we've been told that you're including certain questions on the New York State Arrest Report, that you see JS 3203. You are currently including questions like the residence status, the place of birth, whether or not these individuals are US citizens, and if they are not, you are asking them where they are from. So these questions, there's no, and based on our experience with the Hudson Police Department, there's no law, there's no rule that requires to include these questions on the arrest report. That clearly helps Immigration and Customs Enforcement to proceed to their detentions. So what do you have to say about that? Why are you including these questions?
Well, Hudson Police Department, they govern their own police department the way they see fit. Sheriff's Office does the same. We complete all forms completely, and we will continue to do that. The forms provided through New York State, and we'll continue to complete the forms in their entirety.
Even though, I'm sorry, just to clarify, even though there are other police enforcement like Hudson City Department who's not including these questions on the arrest report, there are other departments that they are not including these questions if you still do that.
Again, Hudson Police Department governs their own rules and regulations and policies as the Sheriff's Office does. And as I stated, these forms are, like as you said, U.S. forms, Department of Criminal Justice Services of the state of New York, and we will continue to complete the forms in their entirety.
Yeah, question. Well, I was just going to ask that these forms are provided by DCJS, the state.
Correct.
Okay.
And, just to clarify, again, if we're referring to this incident, this had nothing to do with our law enforcement division. It did not make the arrest. In this case, the individual was placed in the care and custody of the Sheriff's Office, sentenced, incarcerated into our facility. Corrections has a different set of rules and standards and laws that they need to abide by, and has no bearing on our law enforcement division.
Ma'am,
Sorry,
I'm sorry, I'm not gonna have cross-examination. There's a lot of people in here, and we can come back to you if you have more questions, but ma'am, you raised your hand?
Hi, my name is Jennifer. I think the question that Marcia is asking is that information required by the state of New York for the sheriff's or corrections office?
That's two different questions, actually. So the corrections officers won't complete arrest forms. Law enforcement division does. And as I stated previously, these forms are provided by New York State Department of Criminal Justice Services. And as we've done since the inception of my time here at the Sheriff's Office, we've always completed the forms completely, and we'll continue to do so.
No, I understand that. I'm just trying to understand if it's required.
It's required by our agency.
But so they're required of your
It's required by our agency. So, the position of the state of New York releasing these forms is the position of the state of New York, and I will not comment on the state's.
I would wager to guess if Hudson Police Department doesn't fill out those questions and doesn't have New York State knocking on their doors, and I'm sure it's not required by New York State, it's required.
I would also
By the
assume that too, but I'm just trying to ask a clarifying question and I'm not. saying
Mr.
that-
Chairman,
Yes.
I'm wondering, is this, I commend the sheriff for listening and responding, but is this a new policy of the Board of Supervisors to subject, officials such as the sheriff to be cross-examined by?
That's why I said we're not gonna have cross-examination,
Or even-
but we're
even-
gonna, we do allow public comment and public questions, so we'll
To the
continue.
supervisors, no?
No, we also allow it to the department heads, so I'm not gonna sit here and have him sit on the stand like he's being cross-examined either, but it is appropriate. It's been something that we've done in the past, so you can ask questions, but I'm not gonna have back and forth cross-examination. It's not appropriate. So if anybody has questions, I'm happy to raise your hand, please, and ask a question. And the sheriff can decide whether he wants to answer it or not. Are there any, sir?
I'm Noah Eckstein. So the sheriff has said that everyone has been trained on this policy, but officers are telling us otherwise. What was the content of the training of this policy?
You can pull that information if you wish to. I don't have all the specifics.
There's one follow-up, not across the page. So there's clearly a communication issue, and the sheriff said there's no oversight on this. So how, if.
No oversight on what? I'm sorry.
No oversight on, so if something, clearly there's two different perspectives, like where you're thinking that there was wrongdoing, he's saying there was no wrongdoing. What is the oversight?
The oversight, he's an elected official. It's his policy. He can choose to follow this, not follow this, change the policy. We can make recommendations as a public safety committee, but we have no authority over the sheriff's department as an elected official, as we don't have it over the district attorney's office.
I would like just to clarify that if I can, Chairman. This policy again refers to a law enforcement division. We're not talking about specifics here. You're referring to the incident in question. This is a corrections division, incident. And that doesn't it doesn't govern the corrections division. Again, corrections has to follow a set of rules set forth by the state of New York. A set of laws that are set forth by the state of New York. I think that there's a lot of misunderstanding when it comes to this. And I think honestly that some people have fed some very bad information. We've worked with the sanctuary movement in the past and offered items to the sanctuary movement, such as clothes, shoes, toys. We've never received a call that any of that stuff would be accepted or any further contact of us trying to help out. So I think that some of this information is very misleading that some people may have received.
Questions?
So I'm asking this question as a supervisor, just what clarification on the answer that you gave Chairman Morrell. Most of the policy that you're using for the Department of Corrections comes from the Department of Justice, whatever the acronym is, correct? But you still, just let me finish the question. So it comes from two places. It comes from the state, but you also have an opportunity to craft and add your own policy. So there are two levels of policy, whatever is dictated by the state, whatever you choose to do.
I didn't mean to interrupt you. When you said correct, I was just going to answer your question. So just to answer your first part of your question.
Yeah.
No, all policies are not governed by state law. Some policies are based on operating needs.
Right.
Second part of your question, I'm sorry.
No, that's basically what I was asking. You have an opportunity locally to have your own policies that govern local situations and local needs.
As long as they don't,
It can contradict whatever the state requires. Okay, that's all I want.
Any other questions?
I have a question for your comment allowed, or
I'm sorry?
can I say a comment?
Sure.
I just want to say to the sheriff, that part of the confusion is, like, I understand that you're saying that this is a corrections issue, and that policy doesn't cover the correction. Part of our confusion is that, from our understanding, there was not a judicial warrant. So for you to, compare it to, like, the transfer to if there was a warrant to another agency, that's part of the confusion. And honestly, I don't know, you probably have never been in this situation before where your family member has been taken from ICE, or you have probably never been to the detention center in Batavia, but it's tough and it's not fair. And we look to you guys as part of our community, like you're all supposed to be protected. It is not our job to inflict ISIS policies or immigration policies, and that's where we're coming from as part of the sanctuary movement, as part of the overall community. It's hurtful, and I understand that you have a job, and I understand that you want to give like matter of fact statements. It's also just like, where's the empathy?
It's a comment. You don't have to fix it to you.
You know, I will comment on it. The bottom line is that my job as sheriff is one that I need to be cognizant of the safety and security of all people involved. There was decisions made based on those issues. Whether you feel it's being empathetic or not empathetic, you have to take on that role as a person to ensure the safety and security. Very empathetic of the family and the situation. However, safety and security is what I have to make sure.
Is there any other questions?
Just one more comment. Part of our concern as well in the organization is that we know that there are going to be 10 individuals on the sheriff's custody that will happen the same to them as soon as they get released from again their jail sentence that they are having right now. So we are here because of them, because we don't want them to be detained and be brought to Batavia, just like this community member, it happened here on June 2nd.
My response to that would be that I would strongly urge that you check where your sources are coming.
Hi, my name is Kennedy. Do you have an interest in changing this policy or shifting the policy to be much fairer and, in your words, for the protection of all, to include folks that are undocumented to be included in your safety policies?
All citizens and visitors of Columbia County, anyone incarcerated, this is all policies that are constantly under review. Again, it's not a violation of any policy. And I think some of the facts in this matter are very convoluted. And we're trying to express to the greatest length as we possibly can what we can supply. So if you're asking if we review a policy, yes, we do. And we work in concert with those policies.
Are there any other questions?
So what is stopping the sheriff's department from deciding not to enforce like sexual harassment policies or anti-discrimination policies if you could just decide not to enforce this policy?
Once again, this policy was not violated. Policy, if violated, would have been enforced. This is not a correctional policy, or if it were, it would have been violated in any way, shape, or form.
Is there anybody else that has any questions?
Hi, Kennedy again. Are you interested in working towards changing the form? That if it's not a policy issue, my understanding that it's a form that you're bound to filling out, and the Department of Correction is bound to filling out. Is that my understanding? So again, it's not a policy. It's optional. You are able to work towards changing the need to use that form, correct?
Which form are you referring to, first of all?
The one that we're been talking about this evening, that requires some of the information to be given. It's not required by Hudson. So if we're not able to talk about a policy, then we talk about the form that gives additional information about on intake, requiring status information, as in your works, required by the form, but not required by that policy. So is there a way that we can work towards amending that?
I think New York State, has to make that decision if they want to change their form. This is not something that the county sheriff's office created. So, it's something that the New York State legislation has to make changes on and make a decision.
If I could just make a quick comment, I remember during police reform that some comments were made that we weren't collecting enough information so that we could provide more data. So I just find that interesting.
I just, I was there with Michael and I felt like I wasn't, excuse me, I felt like I was not, I was doing something radical. Sort of, I wasn't a protester. I was there as a supervisor. I go to the jail quite often, and I felt like I was treated as if I was some kind of an enemy of what was going on. And it's just a comment about how I felt as a supervisor at a place which I'm pretty comfortable going in, and I'm not a stranger. And I felt like I was treated. I was there doing something suspicious, wrong. And I remember that day we were out here raising the flag. The district attorney came by and whispered to you in your ear that Linda Musman was there at the jail. Did you know that? Because you commented to me, "Oh, I understand you're at the jail today." I mean,
No. That the district attorney never ever said that to me. I heard from somebody else that you're at the jail.
Well, but he seemed to have a comment to you, and you then, on the heels of that, then you said to me, "Oh, I understand you're at the jail today."
I don't believe I had anything to do with that. He was actually giving me a hard time.
Well, he was. He didn't like that flag.
Madam Supervisor, if you have criticism of me, I'd be happy to respond or not as I choose, but I know what you're talking about.
Pardon me?
I don't know what you're talking about.
Well, I don't know what you're talking about either.
It had nothing.
Anyway,
He did whisper in my ear, but it had nothing to do with that.
Well, now that's something I want to know more about. Because we were raising the pride flag that day.
Yep.
Right.
Anyway, apart from that, my comment is, apart from whatever happened, district attorney and you, that I felt that Michael and I were doing something that was suspicious. And it was on top of the whole conversation about the migrants coming into our community, and that all of the conversation around this publicity that Mr. Harrison was saying was so negative to our community. It just added more fuel to the fire of how we treat people who are.
I don't think that's accurate. I don't think there's any negativity here as far as people coming into the community. I just think it has to do with the fact that we want to be prepared to make sure that we have the assets and the supplies to make sure that the quality of life is there for the people that are coming in. That wasn't, that will continue to be my concern.
Right.
Just a comment, the simplest solution for this is don't break the law. We'd never had this conversation again. We were talking about people that have broken the law, created a crime, put other people's lives at danger. If they don't break the law, we'll never, our service won't have a problem.
Any other questions, comments? Okay. Thank you very much, Sheriff. I really appreciate you standing up and answering all these questions. At this point, I entertain a motion to adjourn.
So moved.
Second, all in favor?
Aye.
Opposed? So carried.
Okay.